Good afternoon. Thanks for joining our webinar, Better Lighting for Better Care, Using Data to Transform Healthcare. Before we get started, just a few housekeeping items. Across the bottom of your screen, you should see several buttons that are your dashboard. Hover your cursor over the buttons to see what each does. Click on the Q&A button to type a question at any time. We'll answer as many of these as we can in the time left at the end of the presentation. Next is the Speaker Biography button. Click this to show the speaker bio or minimize it from your screen. The Certification button is important. It allows you to see your progress toward earning a certificate of completion for this webinar. Stay with us for at least 50 minutes of this webinar and answer the polling questions. Then download your certificate right from the webinar console. Pay special attention to the Survey button too. We need your input to make these presentations even more useful to you. Please bring up the survey on your screen and answer the questions before you leave us today. Finally, the button with the question mark is your on-screen help. This webinar is being recorded and we'll email a link to you, or you can simply use the same link that you used to log onto this webinar. Okay, enough of that. Let's get started. Our presenter today brings a wealth of experience with her. Karen Gale has become a recognized expert in all aspects of lighting a healthcare facility, with undergraduate and MBA degrees from Georgia State University and more than 16 years of lighting industry experience. She leads Acuity brand's healthcare market development, ensuring market leadership in the healthcare space through technological advancements, evidence-based design principles, and voice of customer insights. In just the past few years, Karen has directly connected with thousands of participants across North America via educational presentations, workshops, focus groups, and in-depth seminars on lighting and controls design for healthcare facilities. She is also the author of numerous bylined articles in focused trade publications. So please meet Karen.
Thank you so much, Holly. Thanks for making me sound so cool and important. That's always a nice trait. And thanks to everybody out there who joined us on this lovely webinar day. What we're going to talk to you about today is, really this idea of better lighting for better care. So where we're using evidence and data to transform healthcare, essentially what we're calling optimized environment. So come along this journey with us. But first, we'd like to understand how many people are in the room with you viewing this webinar. No pressure, no judgment. So if you're solo and you just needed some quiet time, no problem there. If you and your 100 closest friends are viewing the webinar, we love that too. So I'll give you a second to fill in that information, hit submit, and then we'll rock on with the presentation. All right, I'll move on in about a second or two for the multitaskers. And okay, we'll move forward. I'll just skip over this one here. In terms of the learning objectives today, we really want to break down some of the key elements of optimized care environments, then move to talking about the role and the importance of patient experience and methods to improve satisfaction and outcomes. We'll move from the patient side of things into the caregiver performance piece of it, describing factors that can impact performance and productivity for our caregivers. And then throughout, we'll spend some time discussing key lighting technologies that can impact all of these factors, really then reinforcing our idea of optimized care. So what is optimized care? It is really three things, which gets as close to a manifesto as probably we get to. We think that patient experience and outcomes, obviously that's paramount. That's what we do in care environments. We're trying to improve health outcomes and ensure that our patient population has the best experience while doing so. The other side of the coin is going to be caregiver and staff performance. Are our clinicians, our staff, is the built environment supporting them so that they can do their best work for patients? And then all of it is kind of underpinned by sustainability, both in the energy and resource sense, right, where we have to do more with less, but especially when you look at the very busy, very constrained healthcare environment, it's about ensuring that the strategies we put in place, the environment of care is sustainable and it's able to be maintained and operated really effectively by our very busy healthcare operations team. So all of those things kind of come together, and we'll spend some time really on the first two in more depth. So let's first talk about experience and outcomes. So I found this awesome definition out there on the internet, which means it's extra awesome, from the Barrel Institute about what is patient experience. And a lot of times we talk about patient experience like it's this one thing. And we all know professionally, through personal experience, that it's not one thing. It's a variety of different things. It's a series of what I call moments of truth where you encounter the health system and you form impressions and perceptions along the way. So the Barrel Institute's definition is really elegant in that it describes it as such. It's the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. So simplish, kind of simple to define, not so easy to do, and there's not one strategy that's going to inform someone's patient experience. It's a number of things that you do in a care facility, and we want to focus on, from a built environment, from a lighting perspective, what can we do to improve that? This is sort of another way of looking at it. Many of you architects, design practitioners on the call, providers on the call, you may have gone through the exercise of mapping patient journeys. And this is a map of a mini journey from a McKinsey paper that they wrote on improving patient experience. And it sort of gives you a sense of the path that a typical patient may take, you know, everything from scheduling to pre-op to surgery to follow-up. Later on in the presentation, we will use this construct again to really talk about the areas where patient experience can either be improved or it may fall short. We know that, certainly in the hospital in the inpatient world, but across different modes of care, we know that we're trying to, so in the United States Patient Protection and Affordable Care Act, or Obamacare, CMS, which is the Center for Medicare and Medicaid Services, a survey was developed. It's really called a CAP survey, which is Consumer Assessment of Healthcare Providers and Systems. And a lot of times we'll see HCAPS in the hospital world, which is essentially Hospital Consumer Assessment of Healthcare Providers and Systems. And essentially what this method, what this survey is intended to do is to align improvements in patient experience with incentives, so with incentive payments. And essentially it's mandatory. It was developed in 2006, and it's part of Medicare and Medicaid's value-based purchasing program. How it works, as many of you know, is that if you're a hospital, for example, and your HCAP scores don't improve over time or relative to your peers, you miss out on a pool of money. That pool of money comes from regular fees that hospitals pay into, or that Medicare pays hospitals. And if you look at the pie chart that's over to the right, you see that of that pool of money, patient experience is 25%, even higher than, say, clinical processes of care. So it really does tell you something about what CMS is trying to drive as part of Affordable Care Act. So this is a view, and I realize probably on your screens this may or may not be easy to read, but essentially what this is showing is HCAP scores. And HCAP doesn't ask you about, hey, did your surgeon do amazing brain surgery on you? I didn't go to med school. Some of you on the call may have, but I wouldn't know how to articulate that, assuming that the brain surgery went well. But I would be able to articulate, okay, what about the environment of care? Were the doctors helpful? Were the nurses, did they communicate how I should take my medication pre-op or post-op? Was the environment clean? Was the environment quiet? And essentially that's the mandatory, those kind of span some of the survey questions that HCAP asks. It asks about communication. If you look at this chart here, the way that the questions are asked it measures how many times the patient responds always to a question. So did my doctors communicate well? That's that second bar. Did they always communicate well? That's what they measured. So what's the red? The red will be no surprise to the healthcare folks on this call. basically the red bar here is that lowest score that you see if you average everybody's HCAP scores, and it's patient room quiet at night. And that is always, noise is such a challenge in healthcare facilities in general, and patient rooms at night is just a particular peeve of our patients. So we'll talk more about strategies, but I just kind of wanted to give you a little bit of sense on what HCAP's covered and, maybe where some opportunities are. If you move on to kind of the next slide here, it really then talks about, HCAPS doesn't address all of the variables that we would care about when we're thinking about patient experience. So if you look at the images, I'll talk to you about what this is. McKinsey did a study on patient experience, and essentially they asked former patients what factors impacted their satisfaction, with care, and then they correlated what those former patients told them with HCAP scores. And what you find when you look at the graphic that's to the right is kind of that sort of aubergine eggplant kind of color. Those are the factors that did correspond or are covered in HCAPS, right? So there's a question that speaks to something like nurse empathy. That periwinkle, and I know you love these whimsical colors that I'm throwing out, that periwinkle blue kind of color, those are all the factors that aren't covered in HCAPS, and there are a lot of them. So for example, how people felt about nurse empathy, that would have had the greatest impact on HCAP scores. But truthfully, and there's not much we can do about this, the outcome, which is probably the fourth down, the outcome of their procedure, that's really the biggest thing that drove satisfaction, right? So if they had great outcomes, they loved it. If they didn't, they tended to think more negatively about their experience, right, which is something that is a little bit more challenging for us to control. The other things that are circled here, so outcomes is circled, but other items like room appearance or facilities or comfort and comfort in the waiting room, those are certainly factors that we control every day, and they actually do rank or correlate relatively highly for patients with respect to HCAP. So this gives us a little bit more insight on maybe where to focus. We know that the whole evidence-based design trend, and many of you on this webinar may be EDAC certified, or if you're not, certainly think that the built environment can influence outcomes. And the whole goal here is to use evidence to make the best possible decisions about design interventions in a facility, and then implement those, measure them, and see that link, So did this factor reduce noise or reduce falls? And that movement is really what's causing us to see some truly innovative, really very interesting designs in the healthcare world, and it's moving us towards a healthier built environment. Speaking of healthy built environments, there is, as many of you know, this movement, almost like this next wave where we saw so much about sustainability in the built environment, with respect to LEED codes, and that's not going to stop. We're going to continue to be greener and more sustainable. But there is also an increasing recognition that, boy, we spend 90+% of our time indoors, and our buildings, not just healthcare, but our buildings aren't necessarily conducive to optimal health. So you see different standards and guidelines, things like WELL emerging. This was a survey, this slide here shows kind of an excerpt of a survey that McGraw-Hill and AIA published. It's called The Drive Towards Healthier Buildings, which was also sponsored by ASID. And there's lots of different colors on here, but essentially if you look over to the right, you see two sections. You see the survey was done in 2014, so it asked people now, it asked owners, architects, and contractors, what are the factors that you think about the most when you're designing buildings? What's impacting your construction decisions the most? And then for the 2016 columns, it asked them to project forward 2 years' time, how much would this factor influence your construction decisions? And so to kind of cut to the chase, if you look at the top, energy savings, certainly you see very high numbers there. Like I said, we're going to be greener, we're going to be more sustainable, and oh, by the way, it costs a lot of money to operate things like lighting or HVAC. So energy savings is always going to be paramount. Aesthetics, certainly. But if you start to look at some of the other factors, improving productivity, where you see that 2 down, an impact of building and health. And architects, I'm looking at you because in 2016, you guys thought that productivity and improving health would be a huge factor in your construction decisions, and we're starting to see that pan out. So whereas I could save you a couple dollars worth of energy, what could I save you, for example, if I were to improve the health outcomes of somebody in a building or to make your nurses more productive? It could be 100x that. It could be 1,000x that. So that's kind of the math that we're starting to see, and it's really exciting as we think about the built environment. This next slide is less exciting, but it shows an opportunity. So not all, in the same paper, in the same survey, they asked medical professionals, okay, well, hey, what do you guys think about the link to buildings and patient health? And they didn't always see that direct link. They also said that they don't get a lot of information about that direct link. So that presents an opportunity for us in the industry, for design professionals, for folks in healthcare facilities that do know the link to really communicate this better. But essentially what these charts show is the burgundy shows, so you've got pediatricians, general practitioners, and psychologists. So those are the 3 pie charts. The burgundy shows, okay, people that thought that there wasn't a connection, they didn't see the connection between buildings and health. And then the blue are people that do believe that buildings impact health. So there's a disconnect. There's an opportunity. So we'll start the process of education. From a light perspective, and I'm kind of a lighting nerd, so whatever your problem is, I kind of think lighting is the answer. I'm sort of built that way. But we know based on the research and the evidence that's out there that light can improve things like reduction in medication, dispensing errors, reduce falls, can provide circadian system support, positive distraction. They can empower patients. So we know this. We're adding to that research base. In this presentation, we'll delve into some specific interventions that are particularly compelling. So let's go back to this idea of this patient journey. So put yourself in your own shoes or a family member's shoes, and let's say, for example, you've got a patient and he or she has had, a chronic pain. Say it's knee pain, say it's lower back pain, and they can't figure out what it is. They have gone to visit their doctor. They've scheduled the appointments to do that. And the next course of action is they just need to get a scan, right? So they need to get a scan to sort of understand what's happening with the tissues. So as you look again at this patient journey, whether it's before you go to a facility or arriving at the facility, if you're going to get a scan, getting to your destination in the procedure, there's so many different moments of truth within this patient journey. Let's spend some time, and I've highlighted a couple, wayfinding, prep and procedure, even just talking about wayfinding. How smooth does that ever go? And I don't want, so I am generalizing. I'm like, I don't want to generalize, but usually it's a nightmare, even in the most well-intentioned, well-designed facilities. So it's something that we really do have to, there's been a lot of focus on it to date, and we need to continue to focus on it because wayfinding is really, really key for patients' perceptions. When you look at this touch point about wayfinding, wayfinding woes, we'll call it. On the right, I've cited Craig Zimmering from Georgia Tech did a study with Emory Hospital, and it found that in a year, the cost of poor wayfinding was $220,000, big number. And a lot of it was due to lost productivity of nurses, hospital staff, who would then help patients get to their destination. So what does that cost? And whether it's $200,000 or $100,000 or $300,000, it's a big number and it impacts perception. So we know that it's a common source of frustration. We also know that strategies such as progressive disclosure, so giving people the information that they need right when they need it as opposed to giving them too much information up front, that's a strategy that people have used in wayfinding. So think about airports, think about hospitals, think about your turn-by-turn directions on Google Maps. Progressive disclosure is seen to be a best practice. Visual cues, right? So this isn't anything new. We use colors, we use iconography. It's the giraffe floor that's orange in the children's hospital. We use that to try to address the issue as well. And still we have shortcomings. What are people doing now and today to change this? So they're using data. So we're seeing the emergence of virtual reality and also sensor-based space mapping, because essentially designers and providers, they want to know if I lay out the building this way, or if this is the way my building is laid out and I'm trying to figure out what the wayfinding shortcomings are, how do I anticipate that? Do I put a VR headset on someone and walk them through a facility? Do I look at space mapping and heat mapping to see what people are actually doing so I can figure out, okay, here's where they're getting lost? Mobile technology is being increasingly used to foster wayfinding. So point-by-point directions, not dissimilar to your Google Maps or your Waze, and they're using indoor positioning technologies to do that. I would be curious, we don't have a polling question on this, but email me or at me at Karen Gale. I'd be curious to see if you guys are using any mobile technology in your designs. There is an example from a paper that I read. So Boston Children's, they had 12 different buildings in a really convoluted complex, and the users reported that their experience improved by 65%. So there's that link to patient experience when they used a wayfinding app. So a 65% jump just via the wayfinding app, which also had other features. So that's kind of exciting. So the idea of using light for wayfinding isn't new. Like if I really want to go old school, I'll take it to this lighthouse picture. We've used light to navigate, to find our way. So we do that now, and they're now, because we are moving into a very digital age, they're now smarter strategies for us to use light as a guide. So one strategy that we use, and we've seen it, we use it in retail. We also see it in aviation, so airports and other examples, is indoor positioning technology. So essentially, there are lots of technologies that are out there, Wi-Fi, et cetera. In our technology, we use visible light communication, so the light is modulated and speaks to a smartphone, as well as powered and connected Bluetooth beacons to give you very precise positioning, so very precise location accuracy. So I've got an image on the bottom. No, I'm not confused. This is a retail store, but if I go into my local organic grocery, I can find the quinoa really quickly via my smartphone app. This is the same type of technology that I think will become really, really pervasive in the healthcare environment. We've already talked about why wayfinding is super important. Why not employ some of these technologies into the healthcare world? And we're seeing a lot more of that happening. The way that it works when you think about wayfinding and what makes sense from an approach perspective, the building blocks of these technology, it really is contingent on having smarter devices. Fluorescent technology, for example, our older legacy technology, it wasn't smart. You could control it. You could have a brain or a central controller that it was linked to that could do things like dim, but I wouldn't say that that technology was particularly intelligent. Now when you look at not just, when you look at LED products, which are digital, and you think about integrated controls, integrated beacons, you start to have these devices that at the local level are more intelligent so they can do more. So in this image here, you basically see a luminaire that has a smart sensor. It has indoor positioning capabilities. It can wirelessly or wired talk to lighting controls and apps. So for simple things like dimming and daylight harvesting, as well as being enabled for things like advanced positioning. If you look at that, the darker sort of image below the light switch, you see a building controller. So very simply, your lighting network can be exactly your building automation network, right? It can connect to other building systems such as HVAC and other subsystems. So when you have the smarts in the local technology, it makes it easier to connect a room, a floor, a building, and have that capability throughout. So smarter building blocks can help us there. When we talked about space analytics, so using intelligence to understand what people are doing, these are some screenshots of our geometric analytics. And what you see at the left of the screen is you may see little dots, and those dots correspond to occupants or users. So if you, as an architect or a designer or a provider, wanted to understand the path that people were taking, for example, for wayfinding, or if you wanted to understand if your emergency department was going to get super congested, you could use technology like this to visually see where people are going. And then over time, you could see, like if you look in the middle of the center kind of bottom of the screen, the heat map, you could start to really understand trends and patterns. What are my more densely trafficked areas versus those that are a little bit more sparsely trafficked? Those are all very, very good tools as you try to get smarter about wayfinding strategies. So wait, there's more, right? So you're like, what? You haven't showed a light fixture too much. This is a lighting presentation. Dynamic design is another way that we can drive better wayfinding in spaces. So this is an image of our Rubik product. And I'll talk to you a little bit about what the Rubik system does. It's a dynamic lighting system. And then I'm going to show you some images that instantly are going to help you kind of understand how something like this could be used in wayfinding. So if I look at just this image here, we know things like color, we know things like the directionality, so lines of light. If I want people to go down a straight hallway, those things are very useful for wayfinding. I'll talk a little bit about the Rubik technology, and then I'll show you some images here. So what is Rubik? So it's a luminaire system that's designed for the grid. There's 3 forms, and I'll show you what that is. There's 3 luminous styles, and the controls are very, very simple. Healthcare is a very key application for it, as well as commercial office, retail, a number of different spaces where you can use this technology. In terms of the 3 forms, I hope you can see this well on your screen, but I have another slide that shows it a little bit larger. You can do essentially a 9-cell configuration, which is a 2x2 form. You can do L shapes, or you can do 3-cell linear. And the 4 luminous styles are static white. You can do tunable white, which, the color of light, the CCT can change over the course of the day. You can do grayscale, which is different shades of gray, but you have constant illuminance on, say, for example, a task plane. And then there's also color accent. I'm going to spend a little bit more time on each of these. The next point here is that the controls interfaces for something like this, which can maybe feel complex in some cases, is really, really simple. So even if I wanted to do tunable white, right, change the color of the light over the course of the day, for example, I can schedule very simple scenes through software, and my button controllers in this space aren't theatrical controllers. They're simple 2-handle controls where I can on, off, dim, and I can also change color, right? I can change color temperature, or I can also flip through different color accent scenes, and I'll show you a little bit more about that. This breaks down the 3 forms. Hopefully you can see this on your screen, where you've got the 9-cell, you've got the 3-cell, and you've got the 5-cell corner. Think about using these as different building blocks, so you're only limited by your imagination. So as you move people through a facility, for example, or you want to create visual interest, you're not really constrained. The 4 luminous styles here, the static white and the tunable white, those are represented in the image just below the bullets. Grayscale essentially changes the intensity so that the surface has beautiful white light, but in the ceiling you have sort of a mosaicked gray pattern. And color accent, here shown in the center, the color accent square can be anywhere, and you can use beautiful saturated color, even dark colors, to assist with wayfinding or to coordinate with your design palette for finishes. With respect to static white, what I love about this system is it's beautiful, but it's also super practical, right? So 120 lumens per watt, that's pretty darn good. It definitely allows you to have that energy efficiency that we really need, very useful light in the space. And the tunable white is very efficient as well. There's 2 ranges for the tunable white. One is a broader, what we call rhythm range. So for example, if you were going to do, say, a daylight simulation, you could use that rhythm range because it goes from very warm to very cool, right? So that could change over the course of the day. On the productivity range, it's a more narrow range. So you could, for example, use 3000 K, slightly warm of neutral for a more comfortable mood. You could use 5000 K, for example, if you want to create a little bit more alertness, or visually you want to see things that present very well under cooler light. For example, if you want to examine a vein. The color accent is slightly magical, and they wouldn't let us put magical on the specification sheet, which I think is a myth, but it's awesome. So a lot of times when we think about color in light, we're considering additive color. So RGB, red, green, blue. I put those together and I get white light. And usually what I'm working with are saturated colors, sometimes pastel colors. I can't usually do olive green or brown or beige using additive color. I just can't do it. That almost feels more like subtractive color, CMYK, what you would see more on the pigment side. Based on the design of this luminaire and the concept of contrast, we are able to give you the saturated colors, the pastel colors, but also dark colors in this space, which is amazing. And that's all enabled by Enlight and Entune. So this is kind of a color palette, 100 colors that you can make. Many of those will be preset. You can also do custom colors. But as you look at this, I mean, dark olive green or brown, that's really something that wasn't possible before. Let me stop talking about it and show you some images here. So again, this is the same shot that you saw initially, and this is a office or office type setting. But look at this next one. And yes, I know that the chairs magically change colors, but for example, if that was your decor, you could bring in those darker, more saturated oranges. Also, same design. Now you can see that you can reconfigure it, for example. So say you had a waiting room and you had seating area where you had clusters of these luminaires. This could give you a sense of place, right? While you could also use the linear layout for moving people through, say, a corridor. Here's another one where it's the same configuration but with some color accents. And here's a different setting. It's a lobby or a waiting area where here you have something that's a little bit more freeform with the color accents. Or this one, it's a little bit more geometric with the color accent in the middle. It can mimic, the windows or whatever shapes you would like to. And then this next piece is showing the grayscale just in lines. This certainly is evocative of a sense of movement. So I certainly have not done it justice, but definitely wanted you to know about the Rubik launch because I think that there's so many products that you could use, but when you think about wayfinding, between the indoor positioning and something like Rubik, those are great approaches that we didn't have before. So let me ask you a question. So you've kind of got to see this to really get it, right? And so slides don't do it justice. Let us know if you'd like to see a demo of Rubik with Entune in your own facility or in your offices. So yes, maybe, or no. Don't say maybe. So non-committal. Just kidding. If you want to say maybe, you can. So I'll give you a couple of seconds to answer this one. Let us know if you'd like to see a demo of this. It really is an amazing solution that has applicability certainly in healthcare, but other settings as well. Okay, I'll give you 2 or 3 more seconds. Okay, so moving on. This next slide is sort of informational and it's sort of a PSA, right? A public service announcement about a patient's POV, so point of view, literally. In this image, certainly we have a linear accelerator where patients are lying down and they're staring up at the ceiling. And it's great. There's a graphic luminaire in this scene, and it really is very comforting. I think that each of us have done this, and I toyed with sort of asking people on Twitter to show kind of what that looked like in a real healthcare setting. But many of us have been to beautiful, wonderfully designed healthcare facilities, and then you go to an exam room or a fluoroscopy room or an MRI room or a radiology room, and you look up at the ceiling, and it's not so nice. Really scary viewing angles, very bright luminaires, luminaires that can't dim when you're trying to relax. And the lighting does make a difference, but we don't really consider it. And sometimes we don't really consider that. Many of the times our patients are lying and lying on their backs and they're facing up. And they're looking at the lighting. So just really a thought to consider that. Consider glare and viewing angles and dimming. Many of you do that anyway, but we still see a lot of opportunities out there. Another radiology application, I just want to make you aware of this, is MRI. Acuity does have a solution for MRI downlights where you can get the comfortable viewing angle that's really, really important, but you can also get the energy efficiency, the configurability, the lumen packages, the forms in round and square, and really have a product that's very suitable for this very demanding MRI environment where it needs to be non-ferromagnetic, it has to have very low EMI, and the design considerations and the installation considerations are very specific. So I definitely wanted you to be aware of it. One of the best things about the product, in addition to the visual comfort of it, is the controls and the fact that it's using drivers or eldo LED driver that really smoothly dims to less than 1% to actually 0.1%. And that's really nice when a patient's doing a scan, to be able to dim it down to the level where the radiographer can see the patient, but the patient can sort of try as best they can to be as comfortable and to relax when they may be very anxious. So that's definitely just kind of giving you a sense that that's out there. Here's another touch point, and I'll touch on this relatively briefly. What I'm calling Circadian Rhythms in the Blues. So it's not a new song. It's this idea that lighting impacts us visually, so via our rods and cones. We know that being able to see in healthcare is an important thing, but it also impacts us biologically. And what we've learned in the last really about 15 years is that we have special photoreceptor, a special type of photoreceptor in our eye, the intrinsically photosensitive retinal ganglion cell, or the IPRGC, that really impacts our circadian system. So it is most sensitive to blue light, and it wants that during the day, but it really doesn't want that at night. And it's not just about blue light. Circadian entrainment is really more complex than that. It's thinking about how much light, what's the spectrum, what's the time of day, and how long did you get the light. So this is something that we really are really starting to consider more and more when we're designing spaces and when we're working with designers in healthcare spaces. One of the best benefits of circadian entrainment, which means that our cycles are in sync with the external day, and our sleep-wake cycles aren't out of whack, is the fact that it is conducive to more restorative sleep. So that's really important. I don't think that in healthcare patients are getting the best sleep of their life. Well, it depends on their medications. But circadian entrainment really does help patients to heal and to be restored as much as is possible, through regulation of the sleep-wake cycle in addition to other bodily functions. And sleep, because light is that primary synchronizer of our biological clock, and because circadian disruption really has a major impact on our sleep-wake cycle, thinking about circadian entrainment in our designs is really important for us as practitioners. Why is sleep a big deal? One in 3 adults report not getting enough sleep. The CDC calls it the epidemic of the 21st century because not getting enough sleep isn't just, oh, I feel tired. It is linked to many of these chronic conditions that I have on this slide, and in fact, I could have done 4 slides with many of the conditions that are linked to sleep deprivation. So don't sleep during this webinar, I'm begging you, but really consider this, and as we design spaces, we have to design for light, but we also have to design for darkness. Really thinking about how we can ensure that in the early morning hours we are enriching the light or definitely having a good amount of blue-rich light early in the day, and maybe we, using a tunable system or a warm dimming system, maybe we reduce the intensity and move to a warmer, more longer wavelength sources later in the afternoon and in the evening, and as much as possible, putting away our tablets and our iPhones and ensuring darkness for night so that we can really support melatonin's production. So this topic of itself could be its own webinar. So we've just kind of touched on it. I do have a question for this group. Has anybody out there in the webinar sphere specified lighting solutions that are really focused on impacting patient circadian rhythm in a healthcare facility? Or it doesn't even really have to be a healthcare facility if you've done it in schools or offices. Curious to know how much experience you've had with that, what some of your challenges were, but you can just respond yes or no here. Curious about that. And I'll give you a couple of seconds here, and then we'll share results. Okay, a couple more seconds. Let's see. Okay, so this is interesting. So 25% of you have specified lighting solutions that affect patient circadian rhythm, and 75% said no. So that's what's kind of interesting. I expected it to be a relatively small number with the yeses, but 25% is more than I thought. So this is cool. Lead on, pioneers. If you, just the last thing I'll say about patient experience is ASHI and AHA have put out a paper on patient experience. It's essentially ways to improve it through the physical environment. No pun intended, but it's a little light on lighting. So their lighting is covered, but it's really more around, I think, some of the aesthetics and not all of the evidence that we know that lighting can impact. So use it as a resource. It came out of in March of this year, but certainly use your other resources and to learn more about the other ways that lighting can impact the built environment. So what about the caregivers? So we talked about patients for a while, and let's segue a little bit to caregiver performance. So nurses, as we know, are really at the forefront of care delivery. And so we asked them, so what do you think about lighting? Do we know? There certainly is some information in the literature about nurses and lighting and performance, but what do they really think? What do they like? What do they not like? Now this is a quiz. This is kind of like Jeopardy, so get really excited. I want to find out from you, which areas of existing facilities do you think nurses need the most lighting improvement? Or sorry, let me ask it another way. Which areas of existing facilities do nurses think need the most lighting improvement? So do they think the patient room, corridors, nursing stations, or diagnostics rooms? And I'll give you a couple more seconds here. But hopefully it was like Jeopardy and you buzzed in quickly. So let's see if you predicted what nurses thought needed the most improvement. And I'm moving forward. Okay, so it was a split here. So you had 35% patient room and about 39% nursing station. Dun, dun, dun. Let's see. Do you like my theme music? Okay, I'll try not to do that again. So we basically asked nurses about their lighting. And if anybody in the call gets LD&A, so Lighting Design and Application, we have an article about it this month, or sorry, in the October issue, Nurses' Impressions of Lighting. So we worked with Georgia Tech's Cimtigrit Design Lab, and so special shout out to Jennifer Dubose, Katie Hottie, and Erica Ryherd from the Cimtigrit Design Lab at Georgia Tech for really doing this research on our behalf. And essentially, we asked nurses about what they thought with lighting quality, lighting quantity, disturbing conditions such as glare, access to lighting controls, other open-ended questions, and then we also had some screening questions about, some demographic questions, so work shift, age, gender, as well as eye conditions, so if you needed corrected lenses, et cetera. So just to kind of break down who participated, I don't have the gender slide on here. It was 95% female, 5% male. When you look at the age breakdown, our biggest group of respondents were over 50, so about 49% were over 50, and then the next largest group at 37% was between 30 and 50 years old. Relatively, so if you look at the middle bottom chart, relatively tenured group. So 34% had worked in their unit 11 years or more, 27, 6 to 10, and then 1 to 5 was a big chunk as well. Overall, we took this to mean that they're very familiar with their nursing units. And it was biased. It was that we did have more day shift nurses than night shift, so 73% day and then 27% night shift. So we surveyed participants, and then we did statistic analysis on the survey responses. And for the nurses that indicated that they would be open to doing a focus group, we then held different focus group sessions where we were able to delve into the problem areas, if you will. So let me kind of show you what you're looking at, because there's lots of bars here. So here's my Captain Obvious statement. So some locations on the med-surg unit, and it was a medical surgical unit, had better lighting than others. I know, I just blew your mind with that one. So what I want you to pay attention to is the scale. You've got a 5-point scale here. So there's light blue, which is strongly disagree, and the orange, which is disagree, and then it moves to neutral, and then agree, strongly disagree. So if you look at, so the question here was, are respondents satisfied with lighting at different locations? And if you look at the captions below the bars, you've got CNS is Central Nursing Station, DCNS is Decentralized Nursing Station, PBS is Patient Bedside, PBR is Patient Bathroom, and then COR is Corridor, okay? So if you can look, if you look at the second and third space types, Decentralized Nursing Station and Patient Bedside, which is kind of the patient room environment, as well as patient room at night, what you'll notice is the dissatisfied scores. So the light blue and the orange are higher for those two than they are for the others, okay? So just to kind of back up a little bit, these were existing medical surgical units, different lighting conditions in each, but this was what the statistical data showed, that they were most dissatisfied with decentralized nursing stations as well as patient bedsides. And if you look at the quote on to the right from the focus group, that the data, the focus group sort of reinforced that. Most of the trouble is really in the patient room, you know, whether it's too little or too much in the day versus at the night, and we'll delve into that a little bit more. So if you can look at some of these quotes, and I won't read this word for word, but the top one really talks about light at night, and it was just a real problem for nurses. Either it was not enough light where they had to walk around with flashlights, or it was like Times Square. They didn't have enough control, and so they would blast on a light, and it would startle patients, and especially their older patients would get extra startled when that bright light would come on. And that's what the second quote shows. In some cases, the light would actually frighten patients. So that was definitely deemed to be a problem, that patient bedside. And then in terms of the quantity of light, so what was the problem, right? So they're dissatisfied with it. What was the problem here? The decentralized nursing station and the patient bedside nurses also said that the quantity of light, they just either had too much or they did not have enough. So it was not quite right. So we got a little bit more detail on those responses as well. What else did it show us? Access to lighting controls. So lighting controls, as defined in our survey, was focused on light switches and dimmers. So in this particular slide, switches and dimmers are all mushed together in the lighting controls category. Mushed is a technical term. And so what you'll see is have lighting controls is green, and the don't have lighting controls is blue. So many of the spaces had lighting control, some form. Much of this is going to be switches. And decentralized nursing stations and corridors did not. That sort of makes sense. We know that in a corridor, sometimes people can't change the intensity if you think about legacy fluorescent technology. But they generally, if you can see in the comment here, they wanted more. Instead of walking in and flipping a bright light, why can't we have something that we can adjust, right? So you certainly saw that across the board. Nurses, and I won't go through every single chart here, but nurses who had some form of lighting control generally had a higher satisfaction rank about the lighting than those that did not. And so the charts here show satisfaction rate at decentralized nursing station as well as the patient bedside. So the comments here are all about dimming. Spoiler alert, they want more dimming. They wish they could dim patient head wall throughout. They really want more dimming across the board. This next, the chart on the right is fairly straightforward. It wouldn't surprise anyone if you're thinking about existing units who may have legacy technology. Most people had light switches. Very few, relatively few, had dimmers. And if you look on the right, particularly when you look at patient bedsides, nurses felt like it was extremely important to have dimming control in the patient room, as well as other spaces. But you can see that blue bar really being high. They thought that was extremely important. And this kind of breaks it down even further about access to lighting controls for patients. So they want the control, but they want their patients to have the control, obviously. So, you know, here's a quote: in our hospital, they can't turn off the overhead light from the bed. They actually have to get up, which we know is a no-no. And another bad thing is that the rocker button for the overhead light, this is another comment, is about 2 inches from the code button. So confusing, right? So do I want to dim the lights, or is there a code happening? So that's sort of a design issue here. The next quote says, patient really needs to have control for their overhead light. If the nurse goes out, if she or he goes out and forgets to shut it off, the patient will then have to get up and be able and have to shut that light off. So we know that that's a design challenge. And then there were some comments about how much the corridor lighting disturbs sleep. By the way, we know that lighting in corridors can disturb sleep. It also has an impact. Remember way back when we talked about HCAP, that hallway lighting also can, if you dim that light, it can also reduce the noise in the corridor. So having less light spill and reduced noise can be very beneficial for sleep, which we all know is a very important thing. And then we found, kind of finally, that ISUs really didn't have a major, didn't really have a major impact on their perception of quality. We didn't find anything statistically significant with folks with eye conditions or wearing contacts or glasses. So how do we give nurses what they want? You know, all the obvious things, right? Empowering the patients, having really easy-to-use controls interfaces, avoiding light spill from corridors, providing nighttime light levels that enable good nurse rounding, but they don't scare the patients, and ensuring that our decentralized nursing stations, we found that it's a combination of quantity of light, so these might be in the corridor and it may be an afterthought, as well as the distribution of light. If you think about a decentralized nursing station that might be next to an observation window, right? So there's some more nuance there around how we design decentralized nursing stations so they're more effective. So this is kind of recapping if we put it all together. Good lighting can really empower patients. So different modes, right? So I can perform an exam under the light, but the patient can also adjust their light based on what they need. Simple controls integration. So the nurse call handset, as well as wall switches for the nurses to come in and easily pick the setting that they need, or the clinician to do that. Good lighting can also enable better sleep. So things like dynamic features, and in this space you see it sort of warm dim. What's the day mode? What's the night mode? So that's really, really important, and it also impacts our HCAP scores, as we mentioned. A couple of products really quick before we wrap up and we do questions. If you are concerned about lighting in the patient care environment, our healthcare lighting brand has a couple of new products which are really exciting. This first one is the Trilume PCX. It's a recessed overbed multifunction solution. It has what we would call an ambient mode with varying intensity for the patients, so that's easy for them to cycle through via a pillow speaker handset. And it also has different modes that the caregiver could use. So they can press a button and they have exam mode. 2x2 and 2x4, really efficacious, really very soft, kind of kind to the eye, so non-institutional in form. Another option is the Intera LED. There's nothing like it. It's really soft, fully luminous, shallow, and it's very kind to the eye, so you're not going to see a lot of distracting glare. Same multifunction features. Same deep flicker-free dimming as you see with the Trilume PCX. Efficient and light-enabled, so the controls are simplified, and this really great, gorgeous, sleek design for your architectural installations. Nursing stations and corridors, we kind of talked about that a little bit, about automatically dimming corridors, and that can improve sleep. Visual acuity for staff is really important in nighttime. And then here's an area, because you've got so much square footage, where you can maximize your energy savings while you improve experience and performance. So last question, and then it's questions for me if we have time. If you saw something that you liked, or if you want to see a demo of healthcare lighting solutions in your facility, let us know. Yes, maybe, or no. We won't judge you either way, but there are definitely more alternatives out there for designing spaces that are great for patients, great for caregivers, and great for your bottom line as a facility owner. So if you haven't looked at products like this in some time, it's good to take a second look, because there are some great new alternatives out there. And I'll give you another 2 to 3 seconds. And then I will move on for questions, if you have them.
Okay, Karen, we got a handful of questions. The good news is that you must have done a fabulous job, because we don't have like 30 questions as we would normally get, but we do have a handful, and I think you might be able to address all of them now. So during your discussion of the HCAPS program, somebody asked, are there any open source aspects of this project, and how can external developers help?
I think that question, and this may be something that we can kind of respond to after the fact, that seems like an indoor positioning question. Open source, I don't know. I think I'll need to get a little bit more clarification on what that question is trying to achieve. Whoever you are,
okay, and we do have,
if it's about development, we can certainly connect with you after the fact.
And we do have the name and the contact information, so we'll reach out to you directly. Sorry, Karen, didn't mean to do that to you. Here's an easier one. When talking about the Rubik, we got a question that is this a 2x2 block size? So I thought you might want to just quickly step through again about the grid.
Absolutely. And let me see if I can push that slide back to you here. It is, let me see if I'll find the slide here, because we did step that through very quickly. So if you can see the slide where it talks about the 3 forms, you can essentially specify the 9-cell, the 5-cell, or the 3-cell configuration. It's designed for the grid, to answer your question, and it's 2x2 form. So the 9-cell, if you look at this image and you look below, that is a 2x2 form. So it's made for that. The 3-cell is 8" by 2, and then the 5-cell is, certainly it spans that 2x2, but it doesn't fill up that entire ceiling tile, if that makes sense. And so you can put these together in different ways. When you look at the specification sheet, you can kind of see different nomenclature and different ways that you can configure it. If you're doing color, for example, the color accent that I showed you for wayfinding, you can specify which specific cells you want to be your color accent square, if you will.
Okay, good. We have a couple questions that I think go together, Karen, that I'll combine together. One is about background information and research information. Do you have access to any studies that show an improvement in patient outcomes when lighting that addresses circadian entrainment is used? And then along with that, there was a separate question that asked how you balance circadian rhythm needs of the patients versus the caregivers. So related question.
Excellent questions. And like I said, we could have spent a really long time on that topic, so I realize I didn't do it justice. To your first question, there are some really good studies out there, some that we're participating in. Acuity is part of the Light and Health Alliance at the Lighting Research Center at RPI, so Rensselaer Polytechnic. And LRC, as you may know, headed up by Mark Ray and Dr. Mariana Figueroa, have done a number of really great research projects in the area of light and health. So we can, in the Q&A, send you some links to the published research. I will say that we are also participating in some research with a prominent New York cancer hospital, and we're looking at the impact of light on some other factors like cancer-related fatigue and some other factors, and we're seeing some promising results from that research, which is yet unpublished. So we can definitely send you some links to what we know. With respect to the other question, the phase response curves and the phase response function for daytime lighting, so if you were essentially trying to mimic outdoors, we understand that pretty well. So we know that, and the research community does, right? We know that it has impacts on sleep-wake cycle, reduces symptoms of Alzheimer's and related dementia, reduces symptoms of anxiety, depression, et cetera. What is less clear, although there's some promising research, is what to do for rotating shift workers, night shift workers. How do you promote alertness without suppressing melatonin? There's some great new research that shows that other colors of light, so red light and some white light, can promote alertness without impacting necessary melatonin production at night. But I will say more research needs to be done to figure out the mechanism, and we're still in the early stages of that. So we know more about what to do in the daytime, really more for the patient population, what to do for, say, particularly night shift nurses. That is an area that's still emerging, but it's promising.
Okay, great. We actually had a few more questions come in, and so I think that what we can promise you is that we will answer all of the questions, and when you receive a follow-up email from us, it will have a link so that you can reference all of the Q&A, including the questions that were answered during this session, but then the ones that came in afterwards. Some of you have also asked about receiving the presentation for sharing or for future reference. We'll send you a link, that link I just talked about, for on-demand viewing. Or you can use the same link that you actually used to join this webinar. When you access it, you just click the already registered link, and it will take probably a couple hours to compile this recorded video. So give it just a bit before you try it, but that will lead you to the on-demand viewing. So with that, I know we went 2 minutes over. I thank you for your patience. I thank you for your participation. And keep your eyes open, because this was the second in our series of healthcare webinars around lighting for healthcare facilities, and there will be more. Thanks, and have a good day.
Thank you.